Today I saw a patient who came to me with a neck pain and the radiating pain towards the right side. He also got his MRI. I thought I will discuss his MRI with you because this MRI is little bit interesting. Let's go to the MRI. What you are seeing is the axial view. This is C3, C4 level, and this is the disc level cut. What you see is the spinal cord here. If you see closely, you can see the bulge here, which is foraminal bulge, which is clearly compressing the exiting nerve here. So he is having C3, C4 level right sided, because in the MRI this is left side, this is right side. Right sided foraminal disc bulge causing compression of the right exiting C4 nerve. And slowly if you come here at C4, C5 level, you could see there is a paracentral bulge here. What is paracentral? Anything which is just lateral to the central is called as paracentral. Here is the paracentral bulge, which is again towards the right side. You could see also a slight disc osteophyte complex, which is clearly compromising the spinal canal. So you can say that there is a spinal canal stenosis happening here. This is a subvarity of disc bulge. So what we saw here is foraminal disc bulge. This is paracentral disc bulge. And then if you come down to the C5, C6 level, see here what you see is the central disc bulge or purely posterior disc bulge. So in this case, this patient is having all three types of disc bulge: foraminal, paracentral and central over here. And if you want to see the normal level, you see this even at C6, C7 also slight bulge you have got, but you know C7, T1 there is no disc bulge. So this is how it should look like. For your reference, I am showing how the normal disc should look like. Even if you go above to the C2, C3 level, there is no much disc bulge as well as in C7, T1 level. But if you see at C6, C7 level, slight bulge but not very significant. But C5, C6, moderate bulge, but the direction is central. Here at C4, C5, it's paracentral. Here is the same patient's sagittal view. You could very well see the disc bulges in the sagittal view. But what you can see in this view is all the bulges are happening posteriorly. Whether it's happening in the right side or left side, you can't make out so much clearly, unlike in the axial view. So that's how you have to compare the sagittal view along with the axial view to get to know whether it's a central bulge or a paracentral bulge or a foraminal bulge. Accordingly, you can make a clinical decision making, as well as you can decide whether the patient needs surgery or he can try with physiotherapy based on the radiological finding. But again, radiological finding alone cannot decide. You need to clinically correlate. And at this point of time, my patient is having pain in the trapezius area and some pain in the shoulder, and he is having numbness in the thumb and the index finger. That's all he's finding. He's currently responding well for the therapy. So at this point, he don't need a surgery. Mostly in the MRI, we see either the disc bulge in the central or paracentral. This patient is little unique. That's why I showed this as an example for you. He is having central bulge and then paracentral bulge as well as the foraminal bulge at three different levels. But clinically, which bulge is actually causing the pain? Not like every bulge will be symptomatic, because most of the pain are largely due to inflammation around the nerves, not really mechanical. If it is mechanical, then everybody should be having back pain, because most of us will be having disc bulges. So largely the inflammation is the reason for the pain than the mechanical. Of course, mechanical do matter. When the disc is causing severe canal stenosis, like let's say 90% or 95% canal stenosis, then mechanical play a role. Otherwise, it's largely inflammatory. So I hope you learned something new today. Take care of your spine, take care of your disc.